Today is International Nurses Day, but a new report has found frontline healthcare workers have a high occurrence of mental health disorders. So what's been done to alleviate pressures on our nurses and doctors? Joining me live is Ruth Limkin, Head of Partnerships and Engagement at Sana Health Group. Ruth, thanks so much for your time. So it's International Nurses Day today. They became heroes of the pandemic. It was great to be able to recognise them today for the work that they do. Without them, the healthcare system would collapse, but it's also a day where we can focus on a bit of light on the mental health struggles nurses face as well.
Absolutely, and I think it's really important. We talk a lot about health policy, but let's talk about the people. And nurses have done an exceptional job, as you said, in the last few years with the pandemic. But what we're really wanting to do today is elevate the health of the mental health of our healthcare workers and really invest in them and encourage them to prioritise that.
So during the second wave of the COVID-19 pandemic, a national survey revealed more than half, so 60%, of healthcare workers reported moral distress due to a lack of resources, and more than half, 60% as well, felt that excluding family from seeing patients went against their values. They still deal with staff shortages as well. What's been done to alleviate this post-pandemic?
Well, certainly what we're doing as Sana Health Group is we're partnering with a great charity who invests into healthcare workers. They run a great number of programs, so we're looking to sponsor programs for nurses from around the nation and encourage them to really get some practical skills to learn how to monitor their health and also how to improve it. And there's a whole range of great health organisations around the country, and we're calling on all of them to really put the focus on the health of their healthcare workers.
We had Peter Dutton's budget reply speech last night in Parliament. The Coalition wants to double the amount of Medicare-covered psychological sessions from 10 to 20 on a permanent basis. Should Labor back that in, rising it to 20 after dropping it to 10? What's your view?
Look, I'm never going to say no to more mental health support happening through the health system. There's huge gaps in mental health and addiction treatment, and I think we need to look not just government but the community and the private sector, all of us working together to really fill the gap of what's needed in our country.
And $587 million has been set aside in the budget for mental health, and part of that spend is addressing urgent gaps in workforce shortages. Yes. Do you have any comments about the budget that was handed down earlier this week?
I'm not going to make a political comment, but I am going to make a person-centred comment, which is we need to continue focusing on our healthcare workers. We need more healthcare workers, and we need to reimagine and bring some innovation to the healthcare space.
You know, this International Nurses Day, when it comes to nurses, you watch videos online about the nursing experience, not just in Australia but around the world, because it is International Nurses Day. And a big theme is it's the little things in interactions with patients that matter the most. It could be as small as a smile or a thank you.
Absolutely.
How important is that you know, we have those nice interactions with nurses?
It's absolutely huge. I've been a patient myself, both in a disease treatment issue and also an emergency, and the nurses, they are the ones who bring the life and the heart and the humanity to what can be a very clinical experience sometimes. And so they're giving out all the time this emotional energy, and we need to work out ways for them to be able to reinvest in themselves as well. The mental health of our nurses and our emergency responders has to be a priority for our health system.
Ruth Limkin, thanks so much for your time this morning. And if you or anyone you know is feeling distressed, you can call Lifeline on 13 11 14.